This has been an evolution. We started out with portal hypertension and then got into viral hepatitis and then also into HCC. So all these diseases are interconnected. So essentially, from a clinical point of view, you have to take care of all of these problems. And then from a research perspective, of course, it makes sense to form groups in these different areas. So essentially, what we're trying to do is to improve the outcome of patients with these problems. And with improve the outcome, I usually mean conservative treatments. So for cirrhosis, as you know, there's always liver transplantation as a good solution, but not everybody is as sick as that he needs it. Not everybody is eligible for it, and not everybody is able to get an organ even if he would be eligible. So despite the fact that transplant is very good, it's not something that you are applying to all stages of disease, and therefore there is a need for conservative management in these areas. And a lot of progress has been made in this field. Survival of patients with advanced stage cirrhosis has improved dramatically, but of course there's still open questions and there's still room for improvement, and that's an area where we're looking at. We're looking into improving the rate of complications, or taking care of the complications of end-stage cirrhosis better, like bleeding, like ascites, like infection. And then, of course, we also try to intervene in order to reduce the rate of portal hypertension in order to make these patients more stable. So what you want to prevent that they have a variceal bleeding, which you can prevent with drugs sometimes, and other times you need other measures. You want to treat ascites if they have ascites, and then you want to prevent that they develop infection of this ascites. And then, of course, you cannot really prevent development of liver cancer, but you can detect it earlier, and therefore you want these patients to undergo surveillance for liver cancer. There's different types of research, and in the different areas of liver disease you need different types of research. For example, in hepatitis C you don't need much research anymore these days about how to find new drugs, because the drugs that are available are fantastic and probably cannot be improved much. You cannot cure more than 100%, so therefore this is something that, in my opinion, is solved. But the big question that remains is, of course, how do you implement treatment for all patients? So you move your research questions from molecular biology or virology towards public health related issues, implementation research, finding all patients research, you know. So there's a lot of things to be done in hepatitis, even in hepatitis C treatment, let alone hepatitis B. A lot of things are unresolved. In hepatitis delta there's no treatment, so we're not running out of questions, even in viral hepatitis.